There it is.
Well, I love that we've almost covered like half of the techniques. For the next one, kind of in terms of elaboration, I wonder if you might be able to give us a kind of a setting where that would be the best choice for an educator to use and kind of how we integrate that for optimal learning.
Yeah, so this is an interesting one. I actually gave a talk during, I don't know, a medical education day or grand rounds or something. And while we were prepping for the talk, they gave me the example. So I feel confident about this one. So elaboration is this idea of going deeper with something, of asking how and why questions in order to get a better understanding and really kind of like broaden your understanding of something instead of just kind of individual facts. And so the example that I was given was in reading charts. That instead of just taking charts at face value, if you ask lots of how and why questions about the things that you're seeing in that chart, it's going to give you a much more elaborate understanding of what's going on with that patient. And this can be applied to lots of different places too. I mean, it doesn't have to just be about like understanding our patients. It can be about understanding knowledge too. But the key here is that you have to be able to answer the questions. And so elaboration is one of these that you don't want to use with novices who are just learning facts for the first time. This is something that you're going to take knowledge further. So you want to make sure people have some knowledge so that they can try to answer those questions.
Well, I'm glad that we have scientific backup for some of the things that we're doing, because that is a classically taught way of kind of precepting with learners. If they're coming and telling you about a clinical case and you want to try to encourage them to dig deeper. We've had some prior episodes on teaching techniques. Specifically, our recent whiteboard mini lecture episode comes to mind, where we talk about using visual and auditory clues to synergistically improve retention, while also being mindful of reducing extraneous load. Could you share some of your favorite tips on how to incorporate dual coding?
Yeah, so that sounds like dual coding to me. So awesome. Great.
Yay. We
so
should
a lot
relabel
of
that
times,
episode.
yeah, right. You just relabel it.
Yeah.
A lot of times, dual coding in the research is really combining visual information with verbal information, which could be auditory, but it doesn't have to be. And medical education uses dual coding pretty darn well already, because it's really difficult to learn anatomy without having both a picture and words, right? You need both. But one of the things that I often tell people about dual coding, because it often gets screwed up, is in creating any kind of presentation. So this is, I mean, PowerPoint, but now people hate PowerPoint, but they do the same thing in Canva or whatever.
So true.
Yeah. So the issue that often comes up is that if you have words on a screen, reading is a pretty automatic process. We see words and we start reading. And so if you have those words on the screen and you're talking, people aren't listening anymore. They're reading the screen. And so one of the biggest things with dual coding is it's not just about kind of adding pictures, but also kind of reducing the words when you do, so that these things are complementary. The other sort of danger with dual coding is that it's not just about throwing pictures up there. Pictures can also be distracting. That if you have a picture and it has nothing to do with what you're talking about, people are looking at that picture going, what is that? Right? And they're no longer listening to you. And so really making sure that whatever the picture is that you're using is demonstrating what it is that you're saying, or what it is that is in the verbal information as well. Does that make sense?
100%. I'm
Okay.
just thinking about, I'm reflecting on how many of the recent PowerPoint lectures that I've either given or given feedback, kind of had a feedback conversation with the person giving it, where I was like, there's too much happening, or I was like, ooh, Ira, the picture you chose, it's unclear how it was related to this slide, or like just, have those moments when you realize like this was dual coding gone well or done right, and this is dual coding maybe not so hotly done. So
Yeah, there's nothing that makes me cringe more than like a paragraph on a slide.
oh
Like,
my
ooh.
gosh, it's death by PowerPoint. It's
Yeah,
the
that's
worst.
right.
It's the